Dr. Lisa Porter. Good evening.
Hi, Mr. Mayor and Council. Thank you for the opportunity to speak today. My name is Dr. Lisa Porter. I'm an associate professor at the University of Windsor, and I'm one of the founding directors of the Windsor Cancer Research Group, or WCRG. This is a group that was established in 2012 with the goal to bring together academic and clinical researchers across Windsor-Essex to elevate the cancer research going on in our area. In just 3 short years, we now consist of 231 medical professionals. We've established 52 new research collaborations. Within our core of researchers, we've recently published 96 research articles, and we brought in just over $2 million of research funding, including launching 12 local cancer research trials that benefits our patients here locally. These are important steps forward in research and capacity to care for our patients. We're really proud of the progress that we've made, but we've come across a very critical barrier, and that barrier is the existing hospitals that we have in Windsor. We don't have dedicated teaching or research space existing at the hospitals here locally. In addition, these structures were not designed to accommodate the types of equipment and that modern research needs, and certainly not to accommodate the future of what we require here in Windsor. One result of this is that researchers are spatially separated from one another, so people of different disciplines do not have day-to-day interactions. We don't get to exchange ideas, data, results, problems, and troubleshoot problems that impact our patients. We also have to transport precious patient samples and even occasionally patients across the city on a regular basis. Another result of this is that our current hospitals cannot obtain what we call academic or research status. This means that our hospitals cannot administer research grant money. Our operating budgets do not incorporate for research and teaching time allocations for the physicians, for nurses, and for other healthcare professionals. Importantly, our hospitals right now are not eligible to apply for many hospital infrastructure and operating grant opportunities that could help to maintain our existing infrastructure and to move us forward in the way that we need. The new hospital plan tackles these barriers by providing modern-day space carved out for education and collaborative translational medical research. Hospital and university administration have already started working together to move forward to make this new hospital a true academic research hospital. This new hospital will allow us to continue to build on the successes that I mentioned earlier. It will bring new equipment, the latest treatments and diagnostics to benefit our patients here in Windsor-Essex. It will provide valuable training opportunities for our students. It's been demonstrated that an increased focus on research and education helps communities attract and retain top medical professionals. I came here from the University of California because I recognize the potential that we have here in Windsor, and I know others will follow. These facilities will lead to more jobs as we increase relationships with industrial partners, biotech industries, and as we optimize the opportunities for us to expand our hospital's operating budget. And this is in fact what employs our nurses and physicians here locally. Most importantly, in a large-scale review of the state of clinical cancer trials in Canada, which I can provide the references, it was concluded, and I highlight from the final documents if anyone wants to see, and I'll read directly from it, that improved outcomes for patients treated in institutions that have active research programs. That means that there are improved outcomes. People live longer if research is incorporated in our hospitals. This should be important for all of us in this room. As I mentioned, I came to Windsor because I see true potential in this area. Research is my passion. I see firsthand the value and importance that it brings to society. I'd be remiss if I didn't admit that it's taken much longer than I anticipated. It's taken much more work, and we've had to overcome many hurdles. But I can say that I've stuck with this project, not only because of my passion for research, but also because of the people I've met along the way. Windsor is full of wonderful people that have become my friends, my colleagues. I've trained many talented students in this area that we want to stay in Windsor. And I've also come in contact and fell in love with many patients and their families. Windsor's an amazing community. I'm excited to be part of this project, and I hope that you'll support this levy. Thank you.
Dr. Porter, thank you for being here and certainly your presentation. You did say something during your presentation that really stuck out with
me, based on your expertise, can you explain exactly what it is the status quo does not allow us to have now in the prospect of a new state-of-the-art hospital with respect to academic and research status? In layman's terms, what does that actually mean, and how does that change from the status quo to the prospect of the future?
Sure. So there's really two major things. There's two major things. One is that our existing hospitals don't have dedicated teaching or research space. And that also is important because it gives you what's called academic or research status for the hospital. This is a real administrative process that actually allows part of your operating budget to, first of all, give you increased salary for physicians and nursing positions so that they, positions that we do have, can have dedicated research and teaching time. Somebody mentioned earlier today that our physicians are very taxed on their time, and that's because we have a hospital here, but we don't account for the time that they have to put in at the hospital. We are trying to do research to better care here, but none of that is accounted for in the budget. So they're doing it on their own time. We're all doing it on our own time. But if you actually have academic or research status at the hospital, your operating budget changes such that it accounts for that. So that's a very important point. Another big important point about that is that it allows for our hospitals to apply for grants that are outside of what they normally can apply for. So for example, the Canadian Foundation for Innovation has hospital grants that our hospitals currently cannot apply for. Those are both infrastructure and operating grants that we're unable to
What kind of dollars are those grants?
Millions. So right now, even the federal grant that just got announced, where the due date is May 9th, that could offer 50% of the cost towards any research that could be matched by the provincial money should it already be in hand. But we're ineligible for this because we currently don't have that status. We have to move towards being research or academic hospitals here.
Thank you, Dr. Porter.
Dr. Porter, did you say you were from California?
I did my training at UCSD. Yeah.
Okay. That's why I wanted to ask you. Your presentation was very enlightening, but I just want to, because of the levy and the questions of costs and so on, the enormous investment, what I'd like you to, I'm not sure if you can answer this question, what you've seen through your experience and observations, let's say in California, in that area, how does this so-called mega project, give me a perspective on this mega project compared to what you have experienced and seen, what we're doing. Give me a perspective.
Well, I can say that, like, at least from the perspective of cutting-edge research centers, and when I say a research center, I mean a hospital that has research and teaching incorporated in it. What's really important about that is that, and I think what's important for everybody to understand, is that this brings the latest treatments, the latest diagnostics, the latest equipment to the patients that are getting treated in that center. Also, like I said, it offers the opportunity to apply for money that can also roll back into the centers. These are really common kinds of I mean, it is also common in Canada, right? So our biggest institutions work in this way. And in Toronto, of course, most of our hospitals work in this way as well. So as far as, I'm not sure how they funded the hospitals in San Diego, if that's what you're asking. But I know that most of the hospitals in, and certainly the hospitals that I worked at, have those facilities, right? So you have active research, and you have researchers and clinicians working side by side. And I think that's also really important because of the idea exchange and the way that things happen and roll forward, right? It's common for a physician to say, I've noticed X, Y, and Z with my patient, and they would ask a question and you bounce ideas off of each other. And this is important for care. I think it's something that, you know, I could say, well, I know this study that's going on here, and I know this grant that you could apply for, and it just keeps those ideas going. We've started this in our city, right? We've started clinicians talking to researchers across the city by starting up these different groups. But like I said, our current system is very ineffective, and we've ran against this barrier. So,
Dr. Porter, so what you're saying really, there's probably going to be a synergy, the investment that we're putting into here, there's probably going to be a tremendous synergy with the new medical school that's going to be probably expanding. We probably will have our own medical school in the future. There's going to be a synergy to really make this area a true healthcare center.
This is exactly
Is
what I'm
that an exaggeration, what I'm saying?
No, this is exactly what I'm saying. This area has the potential. We have a huge area that we serve here, and not only that, we are in close proximity with some of the top U.S. centers. This could truly make us a unique type of research hospital as well, because we do have access to Henry Ford and Kermanos and other types of funding opportunities. I would point to things like the U.S.'s recent investment in cancer research. If you have those types of research linkages here, we could tap into grants and opportunities locally that otherwise wouldn't be available to us. And I think that even outside of other places in Canada, our proximity to the U.S. offers us really unique opportunities.
In the areas in California, are the hospitals that you have become familiar with, were they sort of regional also? Like here, there's this big thing about sprawl, and we've heard it so many times.
Right. I would think that...
Is it regional there also, like we're trying to do here?
Yeah. It's city-specific. So one of the things I think that's so important for us to consider in Windsor is that we are thinking about how we're moving the system forward for years to come, and this is the only game in town, right? The next closest location is London. It's far away. So you want to build something where I realize that right away the budget isn't going to be able to allow you to do everything, but you need to build in a way where we're going to be able to say, bring transplants here, right? This is one of the big things that's on the list. Can we eventually bring transplants to Windsor? Because traveling hours away to get transplants when you're at your weakest is detrimental to the care of people here. It's far away to travel. So we need to build something so that in this area, we've got the ability to build and we've got the ability to bring people what they need. And I think that this is doing it. We're building the foundation, and we need to plan for the future. We need to think about the future and how this moves forward.
Dr. Porter, do you think this investment will also help and be of great advantage to the aging population that we're witnessing right in front of our eyes right now?
Of course, right now, I mean, that's what the aging population is, what accesses most of the health care. Certainly in my area, cancer, aging is the #1 risk factor for cancer. And so it is for servicing our aging population, but also, of course, building for the future as all of our generations age. So.
One last question. Are you familiar with London, Ontario? They have a great center there, medical center. Are you familiar with London, Ontario?
Of course, yeah.
Do you believe that by having this, we're trying to change our image in this area. Do you believe by having this mega hospital, which will service so many in the region, perhaps Canada won't stop at London for a change?
Yeah, exactly. We want the 401 to continue on to Windsor.
Thank you, Dr. Porter. I appreciate your comment.